Prostatitis, or inflammation of the prostate gland, is a common condition affecting men, particularly those between the ages of 30 and 50. The prostate is a small gland located below the bladder and in front of the rectum, responsible for producing fluid that nourishes and transports sperm. Prostatitis can cause a wide range of symptoms and may significantly affect a man's quality of life. Types of prostatitis. Prostatitis is classified into 4 main types, each with its unique causes, symptoms, and treatment options. 1. Acute bacterial prostatitis. Cause. This type is caused by a bacterial infection, typically by organisms such as Escherichia coli or other gram-negative bacteria. It often occurs due to a urinary tract infection (UTI) spreading to the prostate. Symptoms. Sudden onset of high fever, chills, and flu-like symptoms. Severe pelvic or lower back pain. Painful urination, difficulty starting urination, or frequent need to urinate. Sometimes blood in the urine. Diagnosis. A digital rectal exam (DRE) often reveals a swollen, tender prostate. Urine tests may detect the presence of bacteria. Treatment. Acute bacterial prostatitis is treated with antibiotics, typically for 2 to 4 weeks. Hospitalization may be required in severe cases. 2. Chronic bacterial prostatitis. Cause. This is a persistent bacterial infection that often follows an episode of acute prostatitis. It may occur due to inadequate treatment or recurrent UTIs. Symptoms. Recurrent urinary tract infections. Persistent pelvic pain. Painful ejaculation. Symptoms may wax and wane over time. Diagnosis. Cultures from urine, prostatic fluid, or semen are used to identify the infecting organism. Treatment. Long-term antibiotics 4 to 12 weeks are usually necessary. In some cases, surgical intervention may be required to remove infected prostate tissue. 3. Chronic prostatitis, chronic pelvic pain syndrome, CP-CPPS. Cause. The exact cause is unknown, but it is believed to result from a combination of factors, including autoimmune response, nerve damage, psychological stress, or prior infections. It is the most common form of prostatitis. Symptoms. Chronic pelvic, perineal, or lower back pain lasting more than 3 months. Pain during or after urination. Painful ejaculation or erectile dysfunction. No detectable infection in diagnostic tests. Diagnosis. CPPS is a diagnosis of exclusion, often made after ruling out bacterial infections and other urological conditions. Treatment. Anti-inflammatory medications and alpha blockers to relax prostate and bladder muscles. Physical therapy for pelvic floor dysfunction. Psychological counseling or stress management techniques. Dietary changes to avoid irritants like caffeine, alcohol, and spicy foods. 4. Asymptomatic inflammatory prostatitis. Cause. The cause is unclear and often discovered incidentally during tests for other conditions, such as infertility or elevated prostate-specific antigen, PSA levels. Symptoms. There are no noticeable symptoms. Diagnosis. Inflammation is identified through tests, such as a prostate biopsy or analysis of prostatic fluid. Treatment. Treatment is typically not necessary unless it interferes with fertility or other prostate functions. Risk factors. Several factors increase the likelihood of developing prostatitis. Age. Men under 50 are more prone to prostatitis. Urinary tract infections. A history of UTIs increases the risk. Pelvic trauma. Injury to the pelvic area, such as during cycling or horseback riding, may contribute. Immune suppression. Conditions like HIV or chemotherapy weaken immunity and predispose men to infections. Stress. Emotional stress and anxiety may exacerbate symptoms, particularly in CP-CPPS. Sexual practices, unprotected sex or multiple partners may increase bacterial exposure. Diagnosis. Diagnosing prostatitis involves a combination of clinical history, physical exams, and laboratory tests. Medical history. Detailed discussion of symptoms, sexual activity, and previous medical conditions. Physical examination. A digital rectal exam (DRE) checks for prostate tenderness, swelling, or abnormalities. Urine tests to identify bacterial infections or inflammation. Blood tests to measure PSA levels and detect systemic infection. Imaging tests. Ultrasound or MRI may be used to rule out abscesses or other prostate abnormalities. Semen or prostatic fluid analysis identifies bacteria or white blood cells indicative of infection. Complications. If left untreated, prostatitis can lead to prostatic abscess, pockets of pus in the prostate, chronic pain, persistent pelvic discomfort affecting quality of life, infertility, chronic inflammation may impair sperm production, sepsis, life-threatening systemic infection, particularly in acute cases. Treatment approaches. Treatment depends on the type and severity of prostatitis. Medications, antibiotics, effective for bacterial prostatitis. Alpha blockers, reduce urinary symptoms by relaxing muscle fibers in the prostate and bladder neck. Anti-inflammatory drugs, relieve pain and swelling. Pain relievers, non-steroidal anti-inflammatory drugs, NSAIDs for symptom management. Non-medical therapies, lifestyle modifications, stay hydrated to flush out bacteria. Avoid prolonged sitting or activities that put pressure on the prostate. Adopt a healthy diet to reduce inflammation. Pelvic floor exercises, strengthen muscles and improve urinary control. Stress management, techniques such as meditation and counseling. Advanced treatments, minimally invasive procedures, for severe cases unresponsive to medication. Surgery, rarely required, used to drain abscesses or remove severely infected prostate tissue. Prevention. While not all cases of prostatitis can be prevented, men can take steps to reduce their risk. Practice good hygiene and safe sexual practices. Avoid excessive alcohol and caffeine consumption. Stay hydrated and maintain regular urination. Manage stress effectively to reduce symptom severity. Seek prompt treatment for urinary tract infections or other pelvic issues. Outlook. The prognosis for prostatitis varies by type. Acute bacterial prostatitis often resolves with timely antibiotic treatment, whereas chronic forms, especially CPPPS, may require long-term management to control symptoms. Early diagnosis and a tailored treatment approach are critical to improving quality of life and preventing complications.